welcome to our show. I am very fortunate, we are very fortunate today to have with us Dr. Cardonick, and he is a chiropractor up in Mount Airy. I believe the practice is called Cardonick Chiropractic, right?
Yes, it is.
Well, we're glad to have you on the show this morning.
Thank you.
I know that a lot of people may have some questions about chiropractic and what it means, and why don't you tell us a little bit more about what that is?
Sure. Chiropractic, it's the natural treatment of health problems using skilled spinal manipulation or the chiropractic adjustment. Chiropractic is a non-invasive, conservative care for health problems that's non-pharmaceutical, no drugs, no surgery. And care really focuses on correcting the cause of someone's problems and not just addressing the symptoms. Doctors of chiropractic are specifically trained to locate and correct subluxations, which are spinal...
Oh, what was that word?
Subluxations.
I don't know what that is.
They are spinal misalignments
okay.
that affect how the body works, and by removing those and correcting them, it allows the body to heal itself.
Oh, excellent.
A long explanation, but that's what we do.
Well, it's not so long if you don't know what it really is. And I want to kind of probe this a little bit more. I know that a lot of people, when they think about chiropractic work, they think about, manipulations of the muscles and bones. But it actually does more than that. Am I right? I mean, it helps people in health-wise, and feeling better, and those kinds of things. How does that fit into all of this?
Absolutely. The chiropractic adjustment removes the interference from your brain talking to your body.
There we go. Okay.
So your brain being at the top, and then your nervous system coming down through the bottom. And by allowing those nerves to do what they're supposed to do, well, then that's how the body heals itself.
Okay. Now, what are some of the misconceptions? Because I remember when we used to talk about chiropractic work, and it was not considered medicine almost. Right. By some people. Right.
Well, it's not medicine. What it is the care for the body to allow it to do what it's supposed to do. So it's really just, opening up the pathways so that the body can do what it was designed to do without interference.
Now, is this what we call homeopathic healing or homeopathic?
Holistic, I think, is the better word, yes.
Okay. All right. Well, I am pleased that you're here because, on Focus on Fitness, we try to give people tips on how to be healthy and what they need to do to take care of themselves. And I know that you may have some of those tips about some of those things, particularly as it relates to age and, well, I know it from playing sports, let me tell you that.
Right.
Because that's where when I played basketball and football, sometimes I'd sprain my ankle or I'd hurt it in some other way and I couldn't quite figure out why it was swelling up, and, we'd bring somebody in to do that. So how does age and all those things fit into that, and activities?
Right. Well, as far as activity goes, I'll address that first. Everything we do impacts upon our body. How we sit, how we stand, how we talk on the telephone, putting the phone between your ear and your shoulder. All of those things become habits, and if you do them incorrectly for a long enough period of time, they're going to affect how your body works. So the key is to see someone as soon as possible in their lives before there's a problem. The youngest patient I've seen in my office, other than family members, was 7 days old, and the oldest was 94. So chiropractic affects the entire gamut of life from beginning all the way to the end.
Huh. Well, I know that not having the right shoes, or sometimes people wearing high heels, gets those folks into your office.
Absolutely. High heels is one of my pet peeves with patients. I address it a lot, so much so that women sometimes will change shoes in the parking lot before they come in. Wearing high heels pushes the pelvis forward, which affects the entire back. Wearing the same shoes for years and years and years and not getting new ones also builds into problems. So we talk about the feet, all the way up to what you're doing with your head.
Yes, but you know that high heels are a fashion symbol, and this is important to them.
Well, they do say beauty does hurt.
Yeah, and it does for some folks. But let's even go to school kids. Today they don't have lockers to put their bags in, and they're carrying them either on their backs or rolling them down. And I mean, hefty books.
They're hefty books and bags, and that's my next patient base, because carrying those backpacks is putting an extra 25 to 50 pounds of weight on their back, and so that they don't tip over, they push their heads forward all the way to keep the balance. Well, then you add the head position with texting and the telephones, it's problems waiting to happen. What some schools are doing is they're giving second sets of books that they can leave them at home, or eventually I see everything going electronic and they won't have them at all, which would really be great.
Yeah, I'm waiting. I mean, I already know a couple of schools that charter schools in particular that are already using the iPad.
Right.
And all of the books, you know, the textbooks are electronic, so you don't have to do anything but carry your iPad around everywhere.
Sure.
I wish I had that when I was in college. Man, they make us buy these, you know, $150 books that we're only going to use for one class.
Exactly.
In this process. That would have been nice in those days. But I also know that one of the things you do is, well, I want to say it this way, crack people's backs. I don't know quite what that means.
Right. Well, that's one of another pet peeves with the high heels. I wouldn't go to someone who was going to crack my back. We use the term adjustment, the chiropractic adjustment. There are hands-on techniques that sometimes make a popping sound. There are non-force techniques that don't. The important thing is to use a technique that will enable the person's body to get the adjustment and not have the person lying on the table being so tensed up and concerned about it. It doesn't hurt. And you know, you're always using the least amount of force necessary to get the adjustment done.
Right, okay. Well, that leads me to posture and walking or sitting or whatever we happen to be doing, because that is all posture, but usually we start with the posture not being quite right. You know, some people slump their shoulders and other people, you know, carry tension in their backs. How do you guys handle those kinds of things? Well,
the posture that someone comes into me with is what they've been doing for their entire lives. So it's a process. And when we get to the exercise portion of today's segment, we're going to talk about posture, but it's about mainly keeping their head up and their shoulders down. The more you can work on that, and I tell patients to look at their posture in a mirror, in a picture, in a window, anything they can see themselves, and to reset. They were born straight. They've learned how to be crooked. Now they need to learn how to be straight again.
Well, let me, that's interesting the way you said that. We were born straight.
Right.
But we tend to act a certain way or do a certain thing, and that creates an imbalance in our system.
Right.
Or an imbalance in our spinal system. Now, most of us carry that most of our lives. I mean, you know, a forensic person can look at our feet and tell us, you know, which foot we favor.
Yes.
Or what side of the skeleton got more wear and tear than the other side of the skeleton, which in life, you know, creates pain or headaches or any number of things. What other things, symptoms or signs that people's posture is bad that we could identify?
Headaches is always the big one, and I laugh when I do my history and I ask a patient, well, how often do you get headaches? Well, the normal amount. There is no normal amount of headaches.
Right.
You know, one headache is more than you're supposed to have.
Okay.
So, you know, any symptom of where things feel off. If you notice that something's not right, well, then you should check on it. When your car warning light comes on, you don't just cover it up with a piece of tape so you don't think about it anymore. You have to investigate it and see what's going on.
Okay. Well, I want to let you know that Dr. Cardonick will be back with us in both the exercise segment, and you can find out more about him at CEFN.org.